Perfect. So as many of you know, FHIR is a transformative health information standard. You heard from our previous presenter, one of the great examples of how FHIR is being used around the world. And today I'm going to explore with you some of the other interesting developments in the FHIR community. FHIR is different from some of our previous HL7 interoperability standards because it is an open API specification and data model that really helps connect systems of different kinds. It's now more than a decade old and has been adopted and used in applications and projects around the world. You can think of FHIR now as sort of the web, except for health data. I want to show you just briefly, at a high level, the FHIR specification contains many different smaller modules, data models for particular kinds of health information. You heard about in the immunization context. You might think of laboratory tests as one kind of data model, or a clinician diagnosis as another. There are 158 such data models in FHIR that are called resources, and each one of those defines exchangeable data content. But what's clear is that this base platform standard supports many, many different kinds of use cases. I'll describe some of those use cases. The approach to using FHIR for those different use cases involves typically some degree of customization or profiling for those particular things. And that comes from the fact that within healthcare information, we always, almost in every context, encounter this problem of the long tail, where there is a common set of things that happen routinely and can be modeled relatively easily. But there's also a very, very long tail of more unique and divergent ways of representing different kinds of information. So FHIR's design is based on the idea that it's possible and important to get international consensus on the core, the smaller set, the 80% that represents the vast majority of what people are doing. And it includes specific techniques for extending the data model or constraining it for your particular use case via a technique called profiles. And so when you hear the word profiles in the FHIR universe, in the FHIR world, it's often in conjunction with a publication that we would call an implementation guide. And I defined here for you implementation guide just because the words may seem to make sense, but it means something very specific in FHIR. It's a specification for how those different FHIR resources and the API interactions or operations are used for a particular interoperability problem. And it includes computable structures, those things that we call profiles, for representing the particular adaptations of the base FHIR standard. So although FHIR has seemingly, in some sense, become an overnight success or appeared on the scene very recently, I wanted to show you the historical timeline of different FHIR versions. So the initial draft was published back in 2011, and there have been several sort of key milestone releases, including the first normative release 4, that happened in 2019, and release 5, our latest release that came out earlier this year. These iterative versions have all been based on the cumulative implementer feedback and suggestions about how to improve over time. So let me share with you a glimpse of the FHIR world, things that are happening with FHIR that are propelling its advancement and its evolution. So the first thing to realize is that FHIR, as stewarded by HL7 International, has inputs from many, many different spheres and realms. One of the very important inputs to FHIR's advancement comes from HL7's 40 or so affiliates around the world, including the affiliate here in Argentina. HL7 has also established regional partnerships, including one with Helena to grow the FHIR community across Africa. HL7 has collaborations with 30 or more different associations, professional societies, standards development organizations, and others that help connect FHIR to different other kinds of standards, as well as to take in the input and perspective represented by different professional societies. HL7 also convenes the FHIR Accelerator Program. Each accelerator is a collection of stakeholders who have agreed to get together and solve particular interoperability problems using FHIR. These different accelerators have different focus areas. For example, the Argonaut project has focused on some core FHIR-related technologies such as bulk FHIR and smart on FHIR. The FAST FHIR accelerator is focused on issues that come with scaling FHIR across larger and larger networks, multiple networks, national infrastructures, and so forth. The Karen accelerator has focused on consumer-directed exchange. Gravity has focused on social determinants of health or social needs. The Codex project has focused on representing common data elements in oncology and now cardiology and genomics as well. Helios has focused on public health use cases such as sharing immunization data and so forth. The Da Vinci project has focused on the exchange between clinical providers and payers. And Vulcan is really focused on developing FHIR-based specifications in the realm of clinical research. We've recently, just this past July, signed an official agreement with the WHO to help bolster our collaboration and the support for adoption of open interoperability standards, including specifically FHIR. You heard mention in our previous presentation about WHO's work with SMART guidelines, and that is one of the focus areas of this collaboration, as is the effective representation and use of WHO's classifications in the context of HL7 FHIR. Now, around the world, many different national regulatory bodies or government agencies of different kinds have developed regulations that are now mentioning or referring, or in some cases requiring, the use of FHIR. This map only shows a handful of those regulations that came from our friends, people we knew we could ask about what was happening within their country around FHIR. But it shows you the widespread interest in FHIR, even at the level of national bodies. Here I also show a few other examples of that growing adoption and interest in FHIR. The table on the left comes from the GDHP, the Global Digital Health Partnership, which is a collection of more than 30 countries who have gotten together and agreed to work on projects and initiatives with focus on improving health through digital technologies, and have a particular focus on interoperability. And when they surveyed the members of the GDHP, you can see that many of them responded by saying that they were interested in and have adopted FHIR in many of their projects, nearly all of the ones that responded to this survey. On the right, you see an image that comes from the US National Coordinator for Health IT, the central government agency in the United States that is coordinating health information technology initiatives. And at the end of 2022, regulation came into effect that all hospitals and provider organizations needed to have a FHIR endpoint deployed. And this map actually shows the live number of endpoints throughout the country that are implementing FHIR, which is quite exciting to see that level of penetration. This current trend began with many different sort of key moments, but I wanted to illustrate, in addition to sort of those things such as national level adoption, big tech company adoption has also been an important driver. And so very early on, the primary cloud vendors, Microsoft, Amazon, Google, et cetera, agreed to use FHIR, and now all have FHIR offerings for storage and for data analytics and so forth. And clearly, Apple's adoption of FHIR in the Health Kit application to help consumers with their mobile device be able to connect to provider electronic health record systems was a key adoption. And as I mentioned, the US federal government was an early adopter in requiring FHIR in some contexts. FHIR has also been the subject of a great many informatics studies and papers. Here I've shown over time, from beginning in 2014 through now, the number of papers that have appeared in PubMed index journals related to FHIR. And you can see a growing trend. I've extended the line for 2023 because we're not quite at the end of the year yet, but you can see that we're on pace for another year with more than 100 papers coming out that reference or relate to FHIR. And if you're curious to have this bibliography, it's something I keep up on my website. There's a link here on the screen, but it would be easy to find as well through Google search. As I mentioned, the work of turning a project specification into something that can be implemented typically uses the publication of an implementation guide, a FHIR specification implementation guide, as its mechanism for documenting those requirements. And HL7 maintains a publishing infrastructure that many organizations use to produce and make available those specifications. Right now, there are more than 400 such projects that are actively working on or publishing their implementation guides using this infrastructure, which gives you some sense of the number of active projects using FHIR. Some examples include many of the national projects. There are probably 15 or so that I know of around the world that are currently building a country-specific implementation guide for FHIR. Several presentations have mentioned the International Patient Summary, a key specification that is designed to help support cross-border care for a patient by including a compact but comprehensive health summary information in the form of a document that can be shared between the country or jurisdiction that has information about the patient and where that patient might be going. And of course, our last presentation focused on a very important use case, particularly in the context of global pandemics, where member states can report immunization-related adverse events to organizations such as PAHO. There are many other different kinds of applications using FHIR as well. For example, as part of the collaboration with WHO, a FHIR software development kit has been developed for the Android platform, which is designed to help support mobile-first applications with a FHIR toolkit that enables creation and use of programs running on mobile phones in the context of community health workers in low and middle-income countries. Also, driving national level projects, the ABDM project, it presents the National Digital Health Blueprint for FHIR across all of the actors in India's national health infrastructure that adopts FHIR as its base standard. And last here on this slide is an example from New Zealand, where in response to the pandemic, they developed a national health service directory that was enabled through a FHIR API that presented all of the COVID testing and vaccine location sites, and that information made available for use in mobile applications and website applications to help people connect to their local care sites. We're really excited about the growing interest in FHIR across the world, including in Africa. The Africa CDC just this year came out with a bold vision statement, with the task force recommending that all new implementations and digital health system improvements in Africa use FHIR as the primary mechanism for data exchange. This is a great vision, and we're excited to see the capacity and interest in FHIR grow throughout Africa. But across the context of not only in Africa and other contexts, the group Digital Square curates a catalog of what's called digital global goods for health. These are sort of reference implementations, software packages that meet a certain strict criteria for becoming named as a global good. Typically, these are open source projects that have tremendous community support and involvement. And across their entire catalog of global goods, 30 of the 36 of those projects use FHIR. And I've listed a few of them here. OpenMRS is an open source medical record system. IHIRS is an open source software system that helps collect, manage, and analyze healthcare workforce data and consolidate those. And the Global Open Facility Registry is open source software for health data administrators who need to analyze, deduplicate, and curate lists of healthcare facilities. And each one of these projects use a FHIR API as a way to interact with other components in the health landscape. So that gives you some sense of who is working on FHIR and what are these projects doing, just a small sample. I want to spend some time now talking about how the standard itself is maturing based on that implementation feedback. So I mentioned in the timeline of FHIR releases that FHIR Release 5 is our latest release. It was published in March of 2023, and it contains about 4,000 incremental changes, which the majority of those came based on implementers who are using FHIR making feature requests. The primary enhancement or new capability in FHIR Release 5 is for topic-based subscriptions. The FHIR R5 also has updated medication definitions that substantially reworked how medicines and their components were represented. There's also some new operations for managing large collections or groups of resources, and more than a dozen new data models or resource types were also created. So as I describe Release 5 and its transition to Release 4, I wanted to define for you this term we use in the FHIR world called normative, which is a label that we use to describe a mature state of a specification or component of a specification where there is no breaking changes allowed, such that previous implementations would become incorrect. And so when we think about what changed in Release 5, one of the things that occurred was that we didn't label any of those resources as normative that were not previously named normative, and that was intentional. But as you can see on this graphic across the top, there are little cells for each resource in FHIR, and the row represents a version release of FHIR, starting from DSTU2, going up through R3, R4, R4B, and R5. And if you look across this timeline, you see progressive maturation of those data models, moving up the maturity scale from 0 being brand new and immature all the way to normative, which is deemed to be highly mature to the point that we don't want to make any breaking changes, or we want to be very careful about any such breaking changes. And you also will notice that there are cases where a resource was introduced and then removed, from the specification in a later version. And that represents ongoing curation and pruning as those new ideas were found to be capable of being represented in existing resources in some way through modification. So this gives you a glimpse of how the FHIR specification has evolved over time. In R5 in particular, if you would like to see the changes from the prior release, there's a page that outlines all of them. You can go to the differential page that's listed here as a URL. There's also a feature that changed whereby we removed or moved out the core extensions that were part of the base specification into a separate package that's still intimately connected, but is maintained separately, which gives us a technique for advancing that more frequently than we publish new versions of the core specification. And that package also includes the mappings between the prior release, release 4, and R5, which means that we have the ability to improve those mappings more readily based on the experience from the implementer community. Like in each FHIR release, there is a mechanism for describing how to translate or transform from a prior release to the current release. And these are described in a language that's called FHIR mapping language. And so for each resource type, you can look for this tab on the page that says R4 conversions, and it will show you the sort of computable structure for how to migrate data from the prior version to the new version. This is extremely helpful. It's not comprehensively successful because there are times when the change between, say, R4 to R5 did introduce things that were too significant for this mapping to work out 100% automatically. And that happens more so in releases that are non-normative. But a big question many of you who have started on this FHIR journey are probably asking or have been asking this year is whether you should move to R5 or not. And so to help answer that question, I pose sort of three main considerations. The first is whether you need the new things that are in R5. And you might ask, well, how much would you benefit? As I mentioned, there are a few, but just no really major breakthrough changes that happen. But there are lots and lots of little improvements that came from that implementer feedback. In particular, if you work in spaces like biopharma, then being aware of the major medications module enhancements would be important. Some of the features that you may be looking for have been backported, meaning a separate specification has described how that feature can work in a prior version of FHIR, as is the case with the subscriptions module, which was so good that we also created a backport to describe how it works with R4. And then last, you might ask, well, how much will it cost me and my ecosystem to move? And considerations for the overhead required for such a change is certainly a key component. When we HL7 kind of look across the industry and consider those three questions, we hypothesize that the cost-benefit ratio for most existing trading systems is not that favorable for moving to R5. And so we expect that many implementation guides and implementations will likely stay based on R4 for some time. But we have thought that before, and industry appetite can change, and there may be growing interest to move more quickly. And so we're planning a survey to help understand more about how the industry is thinking about R5. But even if you are building out new projects or existing projects based on release 4, we recommend that you read through the R5 specification because many of the changes that are there are simply better documentation, not necessarily changes or corrections, but better explanations. And I think R5 offers a good starting point for reading and understanding the specification. It also signals where the next release, R6, is going to be going. And so that brings me to thinking about, well, when is the next version of FHIR coming out and so forth? As I mentioned, we're planning for this fall to release an implementer survey, a market survey, and are anticipating release 6 of FHIR to be a major release coming out in 2026 as our target publication date. The principal aim of R6 will be to establish a broader core data around of the data that's important for patients and patient-related information to be labeled as normative, to have that high level of maturity. And we're working with the community to draw the circle around what exactly fits into that patient data core. But that's certainly the key focus for R6. We're also working to improve our quality assurances processes. We will be investing in version migration assistance to help make it as easy as possible to upgrade to the newer version. and working on developing documentation to support common on-ramps for implementers. And we welcome your advice and feedback in this process. And in closing, I want to say thank you for being part of the FHIR community. I encourage all of you to participate and grow your knowledge through educations, engage, interact with us, provide us feedback. And I'm excited to see the new opportunities for implementing FHIR that you bring to the table. Thank you very much.